Hepatic portal vein. Definition: the hepatic portal vein is a blood vessel that conducts blood from the gastrointestinal tract and spleen to the liver. This blood is rich in nutrients, and the liver processes these nutrients. It also filters toxins. The hepatic portal vein is not a true vein, because it conducts blood to capillary beds in the liver and not directly to the heart. Function: its main purpose is to carry blood that contains digested food, such as glucose, from the small intestine to the liver, where some of the food is deposited and stored, such as glucose that is stored as glycogen in the liver. Location: the hepatic portal vein is located in the right upper quadrant of the abdomen, originating behind the neck of the pancreas.
In this lesson, I want to draw the blood vessels of the hepatic portal system. This is a system of veins that will drain blood from the spleen, large and small intestine. So as we go, quick little review of our anatomy here. So with that base level anatomy, let's begin trying to draw these vessels in. We'll begin with the vena cava. And the vena cava will be coming in and passing through the liver. So I'm going to draw it thusly in purple. And normally we would color that in lab, but I'm not going to mess with doing that at this point. And let me draw coming off of it as it passes through. Let me put a couple little dashed lines so that we know that it is passing through here. Now, coming off of the vena cava, we will give off these branches known as hepatic branches. So the hepatic branches are hepatic veins. Now, continuing from there, that is all we really have to worry about with the liver on the top part. Now, in blue, I want to draw in the hepatic portal vein. I'm going to bring it down and cut it off. Now, this is a little bit more accentuated, drawing it larger just for clarity purposes. The hepatic portal vein in blue. Now, there are three main branches that we need to know at the human anatomy and physiology 2 level. Branches will begin with the first one, and the first one is the superior mesenteric vein. Superior mesenteric vein, I'm going to come down, we're going to give a loop up, and it will supply blood to the colon. And I'm just going to fill him in a little bit more. And it will give off branches. And then we have purple, the vena cava, as its inferior vena cava, passing through the liver, and in gray, the hepatic veins. Blood will drain from the colon and small intestines into these vessels. Blood drains in there into both the superior and inferior mesenteric veins to go to the hepatic portal vein. Blood also drains from the spleen, as it will give off, as we know now, the spleen is used in the immune system. Now, as a quick, just to kind of let you guys know, if you've ever kind of looking at this and you understand the base level anatomy here, some of the problems that we will deal with, that you guys will deal with in healthcare, such as what we call portal cable hypertension. If you get blood backing up in these portal cable veins of the hepatic portal system, if it backflows into the splenic vein, you'll get what's called splenomegaly. And you also can get problems such as coming from the mesenteric veins, blood backflowing into there can cause hemorrhoids. So just understanding some base level anatomy can give you guys a good understanding of some common pathologies you will deal with. But this puts an end to the video on the blood vessels of the hepatic portal system. Thank you.
Implications in medicine: traditional ultrasound system and Doppler. They are important, non-invasive to determine abnormalities in the hepatic vascular diagnostic tools. A prospective ultrasound study was performed to determine the variability of the Doppler waveform in the hepatic vein and its possible relationship to the venous anatomy of the liver. The study of liver anatomy by invasive techniques is not essential for the assessment of a large number of clinical situations, including patients with portal hypertension, with suspect case thrombosis, portal or hepatic veins. Location and guide interventional procedures, location of injury in order to regulate the conduct per-surgical and post-surgical, transsurgical, and assent in the clinical course of different disorders. Pathological. It is by this that ultrasound continues to be the method of choice for its speed, its economy, and its ability to move to different departments. Application in medicine. The purpose of the study present is to make a global approach to the normal hepatic vascular anatomy. Describe all the variants found in the pattern of Doppler weight with speed and look is there some connection between the patterns and normal anatomic variants.
Liver, remember that the sharpness, you will see two things in the, I presume you can get this view now, and that's why I am going to give you some information that the Masabita. If the liver is normal, remember two things. If the liver's echogenicity is normal, its ecotexture is normal, and outer surface is not fine enough, its vessel note the vessel margins. This is hepatic vein, it has very sharp vessel margin. Note the portal vein, it has echogenic fold. Note how much echogenic it is. It's important to remember the level of echogenicity or brightness it's containing. What will happen in disease processes is that the outer margin of the vessels will be blurred. Hepatic veins margins will be blurred. And if the echogenicity is decreased, they may become more sharp. Whereas in case of hepatic veins, if the echogenicity of the liver goes down, this brightness, this brightness will be very prominent. The echo brightness will be much more than you are seeing in this segment, whereas in fatty liver, as fatty the liver will be, this echo brightness will diminish in fatty liver. And in coarse echogenic livers, in cirrhotic livers, you will see that the outer margins of the vessels will be blurred. They will not be sharp. So from these small points, we get the pathology. And just lastly, in this section of the study of the normal liver, I will request you to read the outer surface of the liver, remember it, keep it in your mind, store it. Then the echogenicity of the liver, then the texture of the liver, the uniformity of the brightness, same, the vessels with echogenic border, the vessel without echogenic borders, without echogenic border, with echogenic border, the diaphragm, and the rest what I have informed you. If you can practice this again and again and again on the normal patient, it will take some time, but I assure you, you will not get this much of a detail on the net or even in training centers over here. Do not give you this much of the detail that I am providing you now, free of cost, without any gains and fame whatsoever. Just I am giving you what I have learned in 18 years of my record-based practice, because I do understand that this is ultrasound is going to be the future stethoscope for the doctors, and they should know at least the normal so that they should be able to depict the anomaly in emergency situations. So try this much that I have informed you, and do give the feedback, as I don't see much feedback, and good luck to you. Thank you very much.
Pros and outcomes. The Hepatic portal system basically processes nutrients and breaks down toxins that enter the digestive tract before the blood re-enters general circulation. The main distinction of the hepatic portal system is which connects two sets of capillary beds. The capillary beds allow for the larger surface area as well. The pressure in the capillaries is decreased to allow a more efficient means of filtering blood. Disease: portal vein thrombosis. Portal vein thrombosis causes portal hypertension and consequent bleeding from varices, usually in the lower esophagus or stomach. Diagnosis is based on ultrasonography.
Now this is the cirrhotic liver. You can see the outer surface is irregular, coarse texture, irregular outer surface, coarse texture, and see this is the portal vein. Yeah, this is the portal vein. And this part of the portal vein, intrahepatic part of the portal vein, if you see, this is clear. No ecogenicity is seen in this region, whereas in this region of the portal vein, this part, the proximal part, this is the wall of the portal vein, and it's internally filled with clot. Now this is a clot in the portal vein, non-dilated portal in a cirrhotic liver. Don't confuse this area with a mass or hemangioma, because this is ligamentum teres in terms of section. As you see, it will now this area will become linear. Yeah, you see, now this area that I was saying, you don't say that is a mass unless we are given a 90-degree sweep to the probe. Here it appears to be as a mass. Yeah.
Symptoms: bloating, diarrhea, vomiting, fever, abdominal pain, especially after eating, bloody stool. Diagnosis: clinical evaluation and liver function tests, Doppler ultrasonography. Treatment: thrombolysis. This approach is recommended in acute portal vein thrombosis through the transhepatic route. Portal hypertension. Portal hypertension is an increase in the blood pressure within a system of veins called the portal venous system.
Our liver lecture here. So ascites, what is ascites? Ascites is just what we like to call third spacing. You'll have patients coming into the hospital with just huge abdomens, like abdomens that are out to here, walking like this because of all that fluid inside the abdominal cavity. So why is there so much fluid inside the abdominal cavity? And it all relates back to scarring of the liver that has caused a blockage now with portal hypertension, and they diagnose portal hypertension with anything greater than 10 millimeters of mercury, okay? They'll send a little tube up there, down your mouth, into your stomach, through the duodenum, and up that, that portal vein to measure the amount of pressure being put on that, that portal vein right there, portal hypertension. So if your patient has greater than 10 millimeters of mercury, they are diagnosed with portal hypertension. So there's so much pressure now being pushed on that portal vein, and a decrease in albumin So your albumin levels are usually 3.5 to 5.0. Same exact thing as your potassium. So that's something easy to remember. And now, what does albumin do? Albumin, remember, attracts water. It transports drugs. And it also binds heavily to calcium. So, if you have no more albumin being produced in the liver, your calcium is going down. Your ability to transport drugs is going down. But most importantly, your H2O, your water, is now escaping from the vascular spaces because there's no magnet to pull it in. Spaces, connective tissue, and abdominal cavities. So your patient will have a huge abdomen where it's escaping now. So what do we do with the patient with a huge abdomen like this? What do? The doctor will stick a needle into the cavity called a paracentesis, into the peritoneal cavity, and start draining that fluid out. I'm going to get rid of this.
Cases. The most common case of portal hypertension is cirrhosis of the liver. Cirrhosis is scarring which accompanies the healing of liver in rare cases by hepatitis alcohol. Blood clots in portal vein. Blockages of the veins that carry the blood from the liver to the heart. Parasitic infection called cysticercosis and focal nodular hyperplasia, and disease now seen in people infected with the Aedes virus. Symptoms: gastrointestinal bleeding marked by black starry stool or blood in the stool, or vomiting of blood. Acidity and accumulation of a fluid in the abdomen. Encephalopathy of confusion. Reduced level of pathogen. Treatment: most causes of portal hypertension cannot be treated, yet medication, endoscopy, therapy, surgery, and radiology procedures all have a role in treating or preventing the complications.
Blood from the intestines is collected through a system. The pressure in these veins increases enormously. This can result in abnormal clusters of veins developing and bleeding into the stomach, the food pipe, and the intestines. Till a few years ago, the only treatment available for this condition, which failed to sclerotherapy and banding, was open surgery. Today, interventional radiology offers a minimally invasive alternative. The procedure is called TIPS. A needle is taken from a vein in the neck under image guidance into a vein in the liver. The needle is then rotated and punctured in such a way that it enters the portal vein. Then a wire is passed through the needle into the portal vein and the needle removed. Then a balloon is taken over the wire and the liver tissue that lies in between the portal and the hepatic vein is dilated, then the balloon deflated and removed, and another catheter which contains a metal mesh called a stent is taken over the wire. The stent is deployed across the hepatic and the portal vein, creating a shunt. Now the pressure is significantly reduced and blood now passes through the shunt into the venous system of the body. This is a revolutionary technique which can save lives of several patients who would have otherwise died of severe portal hypertension.
tank.